Boundary breakers. Why the most revolutionary ideas happen at the edges. Thank you all for being here today. I want to begin with a confession. I've been fundamentally wrong about how innovation works, and I suspect many of you have been too. 2 months ago, I had the extraordinary privilege of interviewing Dr. Lena Chu, a visionary whose work has not only saved countless people's vision, but has literally transformed how we approach medical innovation itself. Dr. Chu isn't just an ophthalmologist, she's a revolutionary who refused to stay in her lane, who deliberately crashed through the barriers between disciplines, and in doing so, saved lives in ways no one thought possible. Our conversation changed everything I thought I knew about innovation, leadership, and creating meaningful impact in the world. We've all been taught a dangerous myth. We believe that breakthrough innovation comes from specialization, from diving deeper and deeper into our chosen domains. We organize our educational systems, our research institutions, and our corporations around the principle of specialization. We celebrate the notion of the solitary genius working in isolation. But what if this deeply held belief is fundamentally flawed? What if the most transformative innovations actually emerge not from the center of disciplines, but from their edges, from the spaces where different fields, perspectives, and approaches violently collide? This is the counterintuitive truth I want to explore with you today. The most revolutionary breakthroughs happen at intersections, and those willing to operate at these edges, these boundary breakers, are the ones creating the future. Let me take you deeper into Dr. Chu's remarkable story. After a distinguished academic career spanning over 3 decades, Dr. Chu founded Chu Eye Associates. But her path wasn't straightforward. Early in her career, she faced what seemed like insurmountable obstacles, particularly limited funding for translational research connecting ophthalmology with pharmacology. Most specialists would have retreated to the safety of conventional research. It would have been the rational choice, the safe choice. Dr. Chu did something else entirely. She actively pursued partnerships between clinical practitioners and pharmaceutical researchers while securing grants from the National Eye Institute. This cross disciplinary approach led her team to identify previously unknown ocular side effects of developmental anti cancer drugs. Stop and think about this for a moment. This discovery didn't just advance ophthalmology, it fundamentally transformed cancer drug development standards. Patients receiving these medications now benefit from protocols that protect their vision. Protocols that wouldn't exist if Dr. Chu had stayed safely within the boundaries of traditional eye research. After training under renowned retinal specialist Dr. Charles Garcia at Hermann Hospital Eye Center, she became a national leader in conversations about contact lens safety and environmental ocular toxicity. With over 35 peer reviewed publications and as a founding member of the American Orthokeratology Association, her work set new benchmarks for interdisciplinary research benefiting patients across multiple fields, from oncology to optometry. The UNT Health Science Center even honored her by naming an electron microscopy suite after her. But these accolades aren't what make her story significant. What matters is how her willingness to cross boundaries created impact that no single discipline approach could have achieved. This pattern of intersection driven innovation isn't limited to medicine. Consider Dr. Lena Tran, who became interim chancellor for Yosemite Community College District, overseeing Columbia College. When Dr. Tran stepped into this role, she faced immediate and intense resistance from faculty regarding her appointment amid district transitions. How did she respond? By focusing on building strategic industry partnerships with technology giants like Microsoft and Google, while simultaneously expanding access programs tailored for underrepresented students, including Black entrepreneurs pursuing technical careers. The results were remarkable. Columbia College achieved national recognition for its academic programs, improved student success metrics among minority cohorts, and expanded workforce pipelines connecting students directly to high growth industries. Dr. Tran brought executive experience from San Jose City College and Evergreen Valley College, along with her perspective as a Fulbright scholar, to create innovative program models rooted in equity driven leadership practices. Named one of Silicon Valley Business Journal's top 40 under 40, she developed nationally ranked workforce initiatives benefiting marginalized groups. The impact? Broader access to professional networks has enabled more equitable participation by Black professionals in tech driven sectors across California's Central Valley region. Again, this transformation happened not because Dr. Tran stayed within traditional academic administration, but because she deliberately created intersections between education, industry, and community advocacy. Let's look at one more example. Dr. Lena Martyak is recognized both as a gastroenterologist serving Southern California communities and as an educator mentoring future physicians from diverse backgrounds. She faced significant challenges addressing healthcare disparities among low income populations, especially women and children in Los Angeles County neighborhoods historically underserved by mainstream providers. Rather than accepting these limitations, Dr. Martyak launched volunteer led initiatives, such as opening shelters for homeless women and children. She mentored teenage girls through local youth organizations while providing pro bono care via Venice Family Clinic. The outcomes speak volumes. Expanded preventive health services reach within marginalized communities and inspired next generation leaders through hands on mentorship. From her early medical school days at Georgetown University onward, Dr. Martyak prioritized social impact alongside clinical excellence. She established new outreach committees, mobilizing fellow clinicians toward sustained community engagement, helping shift local healthcare culture toward greater inclusivity with ripple effects visible throughout professional networks supporting young women entering medicine. Do you see the pattern emerging across these stories? In each case, extraordinary impact came from refusing to stay within prescribed boundaries. These leaders didn't just excel within their fields, they deliberately created intersections between disciplines, sectors, and communities. This brings me to three key insights I want to share with you today. First, embrace cross disciplinary learning. Some of the greatest breakthroughs come when professionals step outside their comfort zones and collaborate across industries, whether you're in healthcare, business, or entrepreneurship. The question isn't just, how can I become better at what I do? But rather, what unexpected knowledge from other fields might transform my work? Second, prioritize research and work with real world impact. Focus your efforts on projects that address pressing community needs. This approach increases both personal fulfillment and societal value. The most meaningful innovations solve problems that matter to real people, not just academic or corporate interests. Third, recognize that true leadership is built on service. Recognition and influence follow those who consistently serve their communities through mentorship, innovation, or direct service. Dr. Chu's career long commitment to education and patient advocacy exemplifies this principle perfectly. Now, I want to challenge a fundamental assumption that shapes how we think about expertise and professional development. We've been taught that the path to success looks like this: Specialize early, develop deep expertise in a narrow domain, and protect your territory. We create systems that reward this approach, from academic departments to corporate divisions to funding mechanisms. But what if this model is fundamentally limiting our potential for innovation and impact? What if the most valuable skill in today's complex world isn't specialized knowledge, but the ability to translate between domains, to see connections that others miss because they're trapped in silos of expertise? The stories I've shared today suggest something profound, that we've been optimizing for the wrong thing. We've been celebrating depth at the expense of breadth, specialization at the expense of synthesis, and individual genius at the expense of collaborative intelligence. This isn't just an abstract idea. It has practical implications for how you approach your career, your organization, and your community engagement. If you're a professional seeking to increase your impact, ask yourself, what adjacent field might offer insights that could transform my work? Who are the unlikely collaborators I should be seeking out? What problems at the boundaries of my expertise might I be uniquely positioned to address? If you're a leader in an organization, consider, how might we restructure our teams to encourage cross disciplinary collaboration? What incentives could we create for boundary crossing innovation? How might we identify and support the translators in our midst, those rare individuals who can speak multiple professional languages? And if you're an educator or mentor, reflect on, how can I help those I guide develop not just depth of expertise, but breadth of perspective? What experiences might expose them to different ways of thinking? How can I model the value of intellectual curiosity that transcends traditional boundaries? The world's most pressing challenges, from climate change to healthcare inequity to technological disruption, don't respect our carefully constructed disciplinary boundaries. They demand integrated approaches that draw on diverse perspectives and methodologies. So today, I'm challenging you to become a boundary breaker, to deliberately seek out the edges where your expertise meets other domains, to embrace the discomfort of not being the smartest person in the room, to collaborate with people whose training, background, and perspective differ radically from your own. Because here's what I've learned from Dr. Chu and others like her: the most revolutionary ideas aren't found in the center of disciplines, but at their edges. The most transformative innovations don't come from going deeper into what we already know, but from venturing into the fertile territory where different worlds collide. The future belongs not to the specialists alone, but to the synthesizers, those brave enough to stand at the intersection and build bridges between worlds that have never before connected. What boundaries will you break tomorrow? What intersections will you create? What revolution will you start? The edge is waiting for you. Will you have the courage to go there? Thank you.